Good day, everyone. It's a great pleasure for me to interview Dr. Andrej Skoberne, who set up the ISN Kidney Stone Course. My name is Siddiq Anwar. I am a nephrologist based in Abu Dhabi. I'm also the member of ISN Young Nephrologist Committee, who I represent today. I'm also the acting attendant-in-chief of Saudi Journal of Kidney Disease. Kidney stone is a major problem in our region, and I will gladly welcome this amazing course which Dr. Andrej Skoberne set up. Today, I have a great pleasure of interviewing him about his work, the course, the way he set up the course, and what his future plans are. Dr. Andrej, welcome to this interview. And could you just tell us a little bit about yourself and your institution you work in, and the work you've been doing in looking after patients with kidney stones?
Thank you, Sid. Thank you very much for this introduction. I'm Andrej Skoberne. I work as a consultant nephrologist at the Department of Nephrology at the University Medical Center in Ljubljana. Ljubljana is the capital of Slovenia. Slovenia is just a small European country south of Austria, east of Italy. This is the largest department of nephrology in our country. We have roughly a little bit less than 30 nephrologists working. This is our department also has the only center of kidney transplantation in our country. We're only a country of 2 million, so it doesn't make sense to have more than one center. So we cover everything in nephrology, from transplant to any kind of dialysis procedure or plasma exchange to vascular access. We have nephrologists who are surgeons who take care of their vascular access, the fistulas and whatnot themselves, which has turned out to be a very good thing. Clinical nephrology, treatment of glomerulonephritis. And last but not least, kidney stones. And we started this service about 10 years ago, and we were basically almost the only ones that were doing it in Slovenia at the time. There were some nephrologists that have had a small amount of patients, but I would say that we started off this service in a more organized fashion, and I'm very happy to be working in this field. It's a very interesting field. It's a huge field. There's a lot of patients and therapy that can help. I decided to do this ISN Kidney Stone course because I believe that this subject is a bit neglected in our nephrological community. This is traditionally a disease that urologists treated, but the urologists mainly do one approach to kidney stones, and that is removing the stone, which obviously is an important part of the process, but there's a whole another avenue that needs to be examined, and that is discovering why the kidney stones actually form. And if you understand why they form, then you can go down the pathway of finding steps to prevent further stone formation. And this also has been done by urologists in several countries in the past years. But I think that urologists are slowly moving away from this. And this is a field that is more naturally a part of nephrology than urology, because it's about looking for metabolic diseases, treating metabolic diseases with medications and lifestyle changes. So it's more natural that this part of treatment is part of nephrology.
Thank you, Dr. Andrej, for that comprehensive answer. You touched on quite a few themes there. I would like to break that answer down. So most of the colleagues I interact with are budding nephrologists or mid-career nephrologists. So they want to set up a service. So could you tell us how you got about setting up a multidisciplinary team? And could you tell us the members of your team, how did you bring about all the team members to align to the same goal, and how that has impacted patient care and patient outcomes and patient experience?
Well, I just basically started off by myself. Then I started collaborating a lot with the urologists from our own hospital. I'll give you an example that was very helpful. They used to throw all of the stones away after surgery, just in the bin, and which is a huge waste because then you don't know the stone composition. So I just we made a deal, a pact with each other that they don't throw any stones away. but they don't need to analyze them if they don't want to deal with that. They just need to give them to the patient and say, please take these stones to your home, and maybe one day your doctor will want to analyze them. So that's just one way of collaborating. Obviously, the other way was for them to realize that these patients can be treated outside of surgery by medications that will help prevent new stone formation, and for them to recognize that we have started doing this as part of the nephrology outpatient clinic, and they started to send us their most difficult patients, which are the ones that most need this kind of treatment. For a long time, we did not have a dietitian on our ward, but slowly we started to get more knowledge on renal nutrition as well, and we were able to get a dietitian basically for the nephrology ward, and now he is participating in this as well. So whenever you start a service, you start small, which is fine, and then you slowly build, and it will happen. I mean, if you work on something, the results will come.
Thank you very much. I mean, that is a learning from my own personal experience, is that your persistence, ecosystem building, and team building. Thank you very much. Obviously, all the patients are not the same. The patients I see in Middle East are largely disease of lifestyle, obese patients, patients with diabetes. There is a high consanguinity here, a high intake of processed food. Obviously, heat, environmental factors take place. Could you tell us, how does your experience of managing kidney stones translate to a nephrologist like me in the Middle East or in Africa or Southeast Asia?
Well, the first thing I would say is that there are medications and approaches that are available to most patients in countries. We're talking about diuretics, thiazide-like diuretics. We're talking about potassium citrate. This is not expensive therapy. It's not therapy that has a lot of side effects. It's not difficult to prescribe or use. So this is a field that is physician-friendly, I would say, because it gives you quite simple tools that can do a lot. The other thing I would say is that lifestyle modification obviously is very important. And one thing I learned was that you don't necessarily need a dietitian to give lifestyle information. Obviously, it's much better if you do have one, and you should strive to have one. But that doesn't mean that you can't do anything without the dietitian. So what we did was we asked some dietitian to help us create some text on diets that might be helpful: low sodium diet, low protein diet, normal calcium diet, and so on. And it was my experience that people with kidney stones are pretty motivated to do something, because the kidney stones are so, the pain is so annoying, so difficult to bear, that the motivation is there. Different from other fields of nephrology. For example, it's maybe harder to motivate patients with arterial hypertension to do something, because arterial hypertension does not hurt. You do not feel your vessels getting diseased, but you do feel things here. So it depends on, there are two ways to start this. And this is how we envisioned our kidney stone course, our webinar for starts, because the kidney stone course is made of two parts. One is the webinar that was created live, and there are two additional talks besides the webinar. So can I describe, Sid, what we tried to do there?
Definitely. I mean, this will be the next step. How did you go about, you identified a problem. Clearly, there's a knowledge gap across the nephrology community. How did you go about addressing this knowledge gap? And how did you use ISN platform to disseminate your learnings, your experience, and your knowledge?
Well, for the webinar, the concept was to get speakers that have a lot of firsthand clinical experience in order for them to answer real life problems and dilemmas. And we asked the speakers to construct their talks in that way, to address the clinical issues, the real life issues. And we're very lucky to get Professor David Goldfarb and Giovanni Gambaro, who are two of the most well-known professors working in the field, and they both have a lot of personal experience with treating of these patients. And we asked them to show us two possible ways of starting a renal kidney stone service. One way is that if you have all the diagnostics available for metabolic evaluation, so if you can check citrate in the urine, calcium and whatnot, ideally that's what you would want to do, to identify the problem in more greater detail. Some people have more problem with citrate, some people have more problem with calcium. It's always a good idea, at least in my view, and I think the speakers would actually confirm that, to get more detailed information. And using this information, you can tailor the therapy. Now, granted, there's not much data that is more helpful than empiric therapy, but still, if you can do that, that's the way to go. That's the way to start. But if you cannot do that, it doesn't mean that you can't do anything, because you can do the approach in a different way just by using empiric therapy. So you can prescribe thiazide-like diuretics and potassium citrate even without doing the metabolic evaluation. And Dr. David Goldfarb showed very well both of these approaches. So we try to motivate people who have not started to work in this field to show them that it's not really a difficult field because the medications are available and they're not difficult to prescribe. And even if you don't have the state-of-the-art diagnostic procedures available, you can still work and you can still do a lot of good for the patients. And I believe that the webinar did show a lot of those real-life dilemmas. We also had quite an extended Q&A session where we discussed real-life issues. The second part of this kidney stone course is 2 talks where we wanted to cover the evidence base. So we wanted to show that there's also a high amount, pretty high amount of evidence behind all of these approaches, meta-analysis and whatnot. So we wanted to show that part as well, that this is not just anecdotal experience, there's actual data that is behind these approaches.
Right. So I'm a young nephrologist, say in Africa or Asia, and I set up a service. How do I approach ISN, and how does ISN help me set up courses for niche diseases like these?
Well, that's a great question, Sid, because I think that's the most important question in my view. So if you want to set up a service like this, you need some knowledge about how to treat these patients and how to interpret the various diagnostic tests that you can do. And to start off, I would implore them to see the ISN Kidney Stone Course, and you'll get some very basic information there. The other thing is that the brilliant guidelines that we do have for kidney stones are created by the European Association of Urologists. They have very, very beautiful guidelines also on kidney stones, and everything is very well defined there. They're a very easy read, and they update them every year. Professor Giovanni Gambaro was part of that process as well as a nephrologist. So I think that's the starting point, just to get the basic knowledge. And then you have to talk to your urinary lab to see what kind of diagnostic tests you can do and what is reimbursed by the state, or ask your head of the department if this is something that you can start doing. And if you can, you'll do that. You'll start doing complete metabolic evaluation and start prescribing medications. If you can't, you just give the medications empirically. This has been described in the webinar. There's also a wonderful paper by David Goldfarb precisely on this point, how to give medications empirically without the detailed diagnostic information. So that's how I would start off. You just need a little bit of courage and, like you said, persistence. If you work on a field long enough, you will get results. I'm pretty confident in that.
Thank you. So clearly you work in an academic center and you've got a mature service now. Has this webinar and the kidney stone course brought more visibility to your work and has opened up academic opportunities? Because some of these kidney stones patients have genetic mutations, probably they run in the families. Have you been able to create cohorts where you have studied them in more detail? And could you just enlighten us about that?
Yeah, I can't really say that we've started a lot of research based on this kidney stone course, but I'm sure that there was a lot of visibility for the subject. As far as I'm aware, there's quite a high number of people that have seen the webinar, that have seen the course, and I'm very happy about that. My vision for the future, my dream would be that more doctors would start working on this field. I don't think it's necessary that every physician in every single department works with kidney stone patients, but at least one in each department can start things off. I think there's a lot of benefit that will happen through that. I get quite a number of emails from neighboring countries asking me questions because the service is not as developed, and I'm hoping that this course will start a wave. And I'm also hoping that ISN might be able to help us as to be like sister centers for this particular subject. I think that most of us who work in this field are very keen on having this field develop, widen, and I think we're all pretty happy about helping others to do that and giving additional information even on specific cases. So I'm hoping we might be able to build a network in that manner.
So Andrej, I think you alluded to that over your next plans. ISN's main goal is to disseminate knowledge about kidney disease and kidney disease management and upskilling folks and bringing high quality renal care to a wider region. So is there any way someone could get in touch with you, or would you welcome observers to your program? And how do they get in touch with you?
Well, I would definitely like to leave an email in some way. Maybe I can just tell the email right now. So I'm pretty sure you see my name underneath me. So if you write my name, Andrej, and then a dot and Skoberne, and then at kclj.si. So at kclj.si. I'm more than happy to answer those questions, and I think we would be glad to have people come here over and see how we do it. It's just a small center, but over the years we have, I believe, acquired enough experience to know how to deal with these patients. So if we can do it, you can do it. That's what I'm trying to say. I would really like to thank ISN for helping us in getting this course started. I have to say that Eugenie and the people at ISN who are committed to developing the academy has given me a lot of support, a lot of very helpful information, have solved logistical issues. So I think the supporting people at the ISN are very good at their jobs. And it was very easy for me to finish this course with their help. And I also need to thank Vladimir Tesaj, who is the president or chair of the regional board for Eastern and Central Europe, who actually had a lot to do with this kidney stone course seeing the light of day. So he really gave a lot of support to this project.
Right, Andrej, thank you very much. It's pretty inspiring what you've done, and I commend your efforts. And thank you very much for your time today. Thank you.